correct me if I'm wrong here. So how dental implants are typically done here is you typically go to one doctor that does a surgery, another doctor that puts the teeth on top, and then get them maintained elsewhere. You do it right there. You do all those parts.
We do everything.
That's why it's so fast.
That's why it's so fast.
Okay.
And also, it's very predictable, and we're controlling. You know, I have patients that come to me and they say, you know, I went to my first dentist. He wasn't able to help me, so he sent me to another specialist. I got a price from that specialist. That specialist said, hey, you got to go work with this other specialist that's going to make the teeth. And then by the time they're done, they have to maintain their teeth by another dentist. So they could be seeing 3 or 4 different dentists and still be lost. I have a lot of patients that come in and they said, by the time I added up all the individual treatment plans, we're talking like $40,000, $50,000, $60,000.
Because people travel to see you, is that right?
Yes, yeah. It's
like from out of state?
It's very humbling. I have patients coming from all over the United States to come see me, and it's very gratifying. And the reason they come is because we have a system in place that allows them to get their teeth immediately, very predictably.